Hello friends, I am Dr. Sandeep. I welcome all of you for my channel, YouTube channel, Homeopath. So today's subject is economics of homeopathy. So we learn about natural principles, homeopathic philosophy, and we learn about materia medica, repertory, and so many things we learn. Unfortunately, the economic section is totally neglected or nobody will tell us. So in this video, I am just putting a different topic, economics of homeopathy. So nowadays, beginning practitioners or young homeopathic doctors are in a very big confusion. I'm not talking of all the people. I'm talking a big group of students or practitioners who are really confused or not really, what to say, confident enough to sell their service. Here, economics is really a key factor wherein how to standardize your services, one thing, and what are the standards to fix your consultation and medicine charges, and understanding the market is one of the important factor, third factor, and what is the value formula you can follow and be economically independent, and you will be having a healthy, safe and successful practice in your life. So first of all, how to value your services. So a homeopathic doctor will be having so much of knowledge, so much of practical understanding when he completes his degree and internship. After that, he also tries to be an assistant for so many homeopaths, and he will be assistant for surgeons, pediatricians, so many departments in our medical field. After gaining so much of knowledge, once he decides to practice, so here a new challenge comes in front of him. What is that is how to value my services and how to charge for my patients. So one aspect usually everybody follow is they ask their friends and they will take information from them. What is your consultation fees? Accordingly they will follow. What is the medicine fees? Accordingly they will follow. And they will start adjusting for the patient's needs. So patient is very poor, so we will charge very less. So this cannot be applied for rich people. Unfortunately, if the patient is very rich, you can't ask him whatever you want. It is the command a physician must hold on, because he is catering poor people, he is catering well-off people, he is catering rich people, he is catering billionaires. He must have his own standard. If not, he will be pissed off. Simply because you don't have the command on the subject, one thing, and you don't have the command on the economics. Economic, I mean to say, balancing the things in such a way that you will not be suffering. You will be in a safer ground. For that, you must value your services. You must have a very good self-esteem about yourself, about your knowledge, about your prescription. You will fail. Yeah, I know, I also failed. After failing, what are the strategies to be followed, how to tackle the problem, and you can give a very best service for your patients. This is the total outcome you must look for. One is service oriented, and your language, your body language, your convincing capacity, your understanding about the human natures, all this come into same factor, economics. Yeah. By seeing the person, you must evaluate his financial condition, you must evaluate his mental state up, you must evaluate his total dilemma, what is going inside him. I'm not taking that you must exploit the patient. No, I'm not talking about that. I am talking about how the ground is created, and in that ground, how you can act properly and be on a safer side, and you can serve your patient along with you have a standard and well life which you can lead in your lifespan. So you must understand first yourself, and you must understand your patient needs, and you must make the patient understand that what are you going to give, what are the services you are going to give if he comes for your consultation, if he comes for your treatment, if he comes for your course of medication. Usually homeopaths will not come across acute patients. There is rarely we come across acute patients. Commonly what we come across is chronic problems. 1 year, 10 year, 15 year, 20 year, 6 months. So these are the usual scenarios wherein homeopathic doctors come across. So you must value yourself so that you can value your patient also, and you can decide a amicable financial fees so that you will not be in a problematic state, and patient must not also suffer a lot. An in-between state can be created by negotiation and giving him a confidence that you have a good knowledge, you have an understanding of his problems, and you have a solution for that problem, and in how much time you can overcome the problem, you can guide him. And second is standardizing the value of your services. So what output, what value are you going to add to your patients if he comes to you? What special, you tell me, what special value are you adding for the patient so that he should come at your doorstep? That is very, very important. So then patient becomes more confident on you. If not, there are thousands of homeopathic doctors. There are lakhs of people who are serving homeopathy freely. Yeah. In this big market, what is your specialty? What services extra you are giving? What is your approach? What is your confidence? What is your output? This is all coming under this homeopathic economics. If you understand these things, you can standardize the things. So usually we will be coming across only two types of people. One is acute and another is chronic. In acute, what is that is, if you are capable of finding a exact medicine, then you can take the case and take the responsibility that you will give treatment and cure the patient. If you are not confident, it is better not to touch those acute cases, because there will be something called as acute state in a chronic diseases. Take for example, in diabetes, DKE. So these sugars are in a very high level, HbA1c is raised, and the patient is in very dilemma. And in that situation, acute situation, it is very difficult to handle this type of cases for the senior doctors also. So what is that is, you must be conscious of these things and you must avoid those problematic cases. You may lose some money, you may lose some confidence, you may lose something from the patient, but you are not losing a dent in your practice. Yes, because homeopathic doctors should always be aware of the scope of homeopathy and limitations of homeopathy. Don't focus on limitations, I agree. You must focus on the scope. But at the same time, on the back of the mind, all homeopathic doctors should be aware of limitations. If not, a wrong case, if you take once, and it will be a problematic, and if something goes wrong with the patient, we are responsible. So in those type of cases, it is better to avoid and tell them clearly, we are not in a position to handle this, so please go and take treatment somewhere. So this is one type of patients. In acute, there will be fever, cough, cold, abdomen pain, that, this and everything. In that conditions, if you are capable of finding a proper medicines, then you can handle the patients. According to me, in acute patients, the remuneration or the fees, you can't charge much. And the responsibility is more. Due to that reason, I also have a strategy to take only picked patients, and who are my regular patients, I can give the treatment for those type of people who believe on me. Walk-in patients, if they come and ask for the acute serious conditions, I usually refuse the patients, simply because taking so much of risk and charging very less, and we will be in a soup. Why to create a situation like that? So I will concentrate on chronic cases which are stable and which can be managed very confidently with our homeopathic individualistic single medicine. These type of patients will believe you and wait for the things to happen. So this is very important thing you must look into. So to standardize the fees according to your location, according to your financial expenses of the place, your travel expense, rent expense, reception expense, miscellaneous expenses, all put together, you must know what exactly you are spending daily. Then you can put upon that 20 to 30% of increased amount on the patient. Up to 50% is also okay. So this is a normal strategy what usually I follow. And another thing very important is studying the market. See, one common sense all homeopathic doctors should understand is when a patient come with a acute appendicitis and a homeopathic physician cure him by just taking 100 rupees, it will not make much changes for the doctor, but it is a big change for the patient simply because acute appendicitis in allopathy they will advise him surgery, post-surgical treatment, post-surgical medicines. Altogether, acute appendicitis they charge minimum to minimum in government hospitals 15 to 20,000. In present day scenario, it has increased till 50,000. So, if a homeopathic doctor unknowingly, if he does for this case 100 rupees, so it is substandardization of homeopathy I call. Any surgical cases, you must be aware that patient will be ready to give you. But if you yourself has a self-esteem and charge very less, this is a mistake from your side and you are destroying your practice. So, study of a market, study of the disease, study of your competitive homeopaths is very important. Market understanding is very important because wherever you practice, on the same road, one or two homeopathic doctors will be sitting. We don't want to hurt them. We don't want to do any sort of problem for them. Also, we must protect ourselves. This is the in-between way all homeopaths should understand. Value formulation. So last point, what I want to tell you is how to value your services and how to charge to the patient. So for this, you must understand the standardization of a rupee. So how the rupee is valued. So if you understand this, 90% of the problem will be solved. So today, for rupee standardization, we take dollar as the important value into the market. Previously, all people were using gold and silver as the value. So today, if you want to understand the market or how we are valuing the economics balancely, means that cost is evaluated on the rate of gold, silver and dollar. So wherever you practice, there what is the value of the dollar? What is the value of the silver? What is the value of the gold? You must consider accordingly, you must value your services. So there will be a balanced income in your homeopathic practice. So if you understand these few points, what I demonstrated, you will be having a balanced and successful homeopathic practice. So this is not about homeopathy, but it is really to do with homeopathic beginning practitioners and a person who want to grow, who want to build a homeopathic career in a very smooth, gentle and in a good way. That's all today, friends. If you like this video, please like, share, subscribe. There is a hype button which is already given now, so please hype and also another one button comes in between. That also you just press, so that it will reach so many people who need this information. Thank you, friends. Take care.